Good morning. This is Rachel Leventhal-Weiner, the Chief Research and Planning Officer with the Office of Early Childhood. And this morning, we are glad that you can join us for a discussion about a new program called Connecticut Cares for Childcare Businesses. And to describe the program and give us some more information, here is Commissioner Beth Bye.
Good morning, early childhood community. I hope you're having a good week. We're all getting used to communicating a new way. It's hard for me not to see your faces, to tell you the truth, because sometimes you can learn from people's faces, but we're going to do our best to describe Connecticut Cares for Childcare Business to you. I'm really pleased to announce this program. It's one that's been informed by you through the survey, hearing about the challenges you face. And I have to say, the past couple of weeks have been so difficult for you all. I know that from the emails I'm getting and the conversations I've been having with so many of you making critical decisions about your program. So I wanted to get out some specifics about this program to you as soon as possible with a two-step sign-up process that will start next week. We'll have a second webinar Monday, and then at the end of next week, in the middle of next week, you'll get instructions. End of next week, you can sign up. But I want you to know what's coming as you're planning for your programs to open, or as they're open and you need supports to keep coming. On Monday, I announced our plan for July and August for state-funded programs, that is CDCs and school readiness. I, as commissioner, have state appropriations that are assigned to those programs that I can send out. Like, it gives me some tools in my toolbox to help those programs sustain. But when it comes to private programs, you're a critical part. You're well over half of the childcare supply and preschool supply in the state of Connecticut. So we look to our federal CARES grant for ways that we can help programs that do not get state funding specifically. We know that you face big challenges. All of early childhood across the country is facing big challenges, and we're going to do our best to support you in Connecticut. And the more feedback we get from you, the better able we are to do that. We know that the Connecticut Cares for Childcare Business is not sufficient. We know it's not enough to address all the challenges you're facing, but we hope that it's at least something in this very multi-factored problem that's going on because of COVID-19. We find ourselves in this place because of a virus, and all of us are doing our best in Connecticut, and I'm sure glad to live in Connecticut, where we see such good effects of so many residents' individual efforts and sacrifices to improve our whole state's health and prevent more sickness and death. So we know some of you have had losses due to COVID, and we're sorry about that. And now we're really working on how do we support children and families in Connecticut. I also just want to say thank you to the team at OEC for helping develop this new program. Margaret Gustafson has been leading this work, but there are significant information and technology challenges. This kind of program that we're standing up from an IT perspective would take more than a year and millions of dollars in most cases, and people have been working round the clock to try to get an IT infrastructure that allows us to get money out directly to private programs. So you'll learn more about that in a minute. I already thanked you for the survey. That really informed the formula that you're going to see that we used for Kickstart, and it really told us we needed to add a supply bonus. Okay, Teal, next slide. So we'll get started with the information. At the Office for Early Childhood, we work with community partners to support safe, high-quality programs for all. Also, we want to have responsive customer care. And I think hopefully one thing with this, with the Connecticut Cares for Childcare and Connecticut Cares for Frontline Workers, again, we built those systems just in a few weeks, and we were building it as they were running. And we wish it was smoother, but we know that the funds have really been appreciated, and the direct funding to programs have been appreciated. So we learned a lot through that process that we think will make the Connecticut Cares for Childcare Business rollout smoother. Okay, next slide. So today we're going to go over some reflections that we heard from you all. What are the guiding principles of this program? Tell you a little bit about the business survey, and we'll have, as I understand it, the final report is done today, and then that will be on our website, and then tell you about the package and have some time for questions. So here's some quotes from you all about just the challenges you have accessing supplies. It's been hard to figure out how to apply for assistance, but you didn't want to take out loans. And then what to do about tuition. What do you do when you have no income coming in and you have all these expenses, just plain old operating expenses? So we thank you for sharing that. And we know that this was a business that had a lot of challenges to start. The current business model for early childhood is not so sustainable, and we're all working on this at the national level to improve this situation. But it's going to be challenging to reopen after the pandemic, which is why we have these Kickstart grants. And Louise Stoney says that we have a responsibility as a field to think ahead and use these grants, loans, and TA to help address key structural issues. And that's what we've tried to do there. This isn't just about the grants. This is a comprehensive package of supports, because we know this is not a 1-month recovery. We have a good year ahead of challenges for programs. And we hope that what you'll hear about today, you'll hear that we're really looking at addressing what are some ways we can set up to learn here and to support programs in the long run. So I'm going to turn it over to Margaret Gustafson. Margaret, I ended with a Louise Stoney quote. I know you often cite Louise Stoney in your work when you work with programs on business support. So thank you for your leadership, Margaret, and I look forward to hearing from you about the program today.
Thank you, Commissioner Bye, and good morning to everybody. Thanks for joining us this Friday morning. We really appreciate your time. So as Beth said, the quote from Louise Stoney is really purposeful on our part. Louise Stoney is the co-founder of Opportunities Exchange and the Alliance for Early Childhood Finance, and she often talks about an iron triangle of early childhood finance. In order for the early childhood business to be successful, these 3 parts have to be in place. So full enrollment, every day, every classroom, full fee collection, so full time, on time, and per child cost is covered, so regardless of who is paying. And we know that those are a lot of things that are absent in our childcare businesses right now. And so this package that you'll see that we're rolling out is really geared to making sure that we are building businesses of excellence to match our childcare programming of excellence. So we're going to walk through the following slides. Please make sure that you use the questions function so that you can ask us questions. We'll do our best to get to as many as we can today, recognizing that if we run out of time, we will definitely take all of those questions back and be able to address them over time. So I'm going to focus us now on the slides. In ESF 14, so it's an emergency support function 14, we're focused on recovery, and we have some very important guiding principles that we want to make you aware of. The first, we just always remember that we're here because of the children, right? It's always about the children. So health and safety of the children, families, staff, and partners. Partners include our licensing staff, local health department, anyone who's coming into your program, right? We want to make sure that everyone is well protected. The second guiding principle for our work is maintaining and expanding access to high quality programs. And this has a lot of moving parts to it that you'll recognize. Obviously, right now, looking at the financial stability of the programs, we want as many programs to come out of this pandemic as possible. We want to come out stronger. We want to make sure that our workforce is stabilized. Many of you have talked about challenges with what happens with teachers as they look for other opportunities now. We're very aware of that, not just in early childhood, but also in other industries. The third piece of that, strengthening business health and quality of programs, go hand in hand. As I said, we want businesses of excellence and programs of excellence. So you'll see that we have supports that address both of those. And we also want to build capacity. We're very mindful of making sure that all of our settings, family, childcare, licensed centers and group homes, tribal nations, military installations, license exempt programs, right? And then all of our ages, infant toddlers been particularly vulnerable, and our gaps, making sure that our most vulnerable populations are accounted for. The continuity of care component, whenever possible, we want to make sure that the same child returns to the same teacher at the same program. We know that there is confidence in that. We know that for children and for families, that piece of normalcy is really important as well. Partnering to ensure all voices are represented. As Commissioner Bye mentioned, we are so thankful for your help in the business survey. We listen to all of the emails, all the voicemails, all of the comments that we can to make sure that we are so informed on this. You'll see that we continue to ask you to join us in different ways to be able to inform what we do. And the last one, overall operational simplicity, can't be shouted out enough. If we do something that isn't well planned, it can be confusing and frustrating. We've all had to stretch already, so we're trying to minimize how much more we ask, and we're trying to staff up at OEC to be ready for you. So let's talk about the business survey. So as we launched into trying to assess businesses in the pandemic, we had help from the governor's office linking us with other state departments that were also setting up surveys to figure out what was happening in their respective fields and how best to reply. So we also want to take a minute just to recognize the Yukon OEC partnership. When we talked to you about doing this business survey, we wanted to make sure that everybody was aware that Yukon was in charge of the data on our behalf, and this has been a really strong and significant partnership. We have a very trusted group led by Kate Parr and Kyle Pylon, who did the bulk of the work on this. And we're so thankful that they're here because they bring the expertise that we needed for this. Your input was amazing. We can't emphasize that enough. We asked big things of you, and you were really, really generous with your sharing. You'll see that we looked at every part of that survey. We read every single response. We've tried to incorporate as much as we can, and you'll see that we've identified that as Business Survey 1, recognizing that we'll probably be coming back around, not too quickly, but knowing that we're in a long-term recovery to see how you're doing so that it can help us to frame additional supports over time. So the survey is already over a month old, and that's really important for you to remember when we release it and as you see some data in this webinar. Just to recap, we asked licensed family childcare homes, group homes, and centers, and our license exempt state-funded programs to do this survey. Everything was voluntary, and as I said, you all were amazing. We had a stellar 39% response rate, which is really unheard of in the survey world. And a lot of folks outside of OEC in other states and in government were really, really impressed with this. We thank you so much for that. Personally, I'm hoping I get to see as many of you as possible that I talked to. I know we talked an awful lot during that time. So thank you, thank you, thank you for your input. All right, so let's see how we're going to use that data. As Beth mentioned, we're going to be sharing the full report, and you'll also see a summary. The full report is, I think today, 48 pages. There's a lot of information in there. As we said, you all were extremely generous, and that was phenomenal. You'll also see us use data frames in as many documents as we can, because we want you to be able to see your input and how we're using it. The slide that you're looking at now shows you just what you were thinking a month ago, over a month ago, about how detrimental COVID-19 was to your program then. This is separated by license type. So you'll see centers, family homes, group homes, and license exempt. And as I said, over a month ago. So we knew already it was a significant impact. And none of us had any idea what this pandemic would mean, how long we would be in it, what were the continuing pieces that we would be dealing with. Next slide. You also told us how worried you were, right? And this is a really significant piece that a month ago already, we were worrying about families and staff returning. for whatever this after COVID-19 thing is, right? We're still trying to figure out some of these things. Loss of revenue was a huge high worry for folks. Finding and purchasing the PPE, employee absences, paying staff. So a lot of things around finances and staffing. And then we asked you about what you thought government could help you with. There were, again, many things related to understanding or getting information about supports, specifically also finding debt relief and additional payroll, assistance of any kind, right? So those were pervasive themes that were coming through loud and clear throughout the entire survey. You all were very, very clear about those things. And we still are. So where do we go from here? We talked a lot about having phases and layers of support. When you look at disaster recovery, it's interesting that there's always these three buckets: immediate help, short term, and then long term. And the longer term is, we just don't know how long. This is going to have some really big ripple effect within our field. And so we want to make sure that we're helping as much and as often as we possibly can. So as many phases, as many layers as we can. Initially, we went through things like unemployment benefits. So we're super thankful for our colleagues at Department of Labor. We know that in particular, the pandemic unemployment assistance, the PUA, was really late in coming because they had to build that out. As Commissioner Bye mentioned, it's so hard to be able to forecast these things and have them ready. So trying to minimize our problems becoming your problems has been an important learning experience for all of us. Additionally, things like Federal Head Start continuing to pay its programs. OEC also continued to protect its investment into programs receiving care for kids, school readiness, child daycare contract, and state Head Start. Then we opened up the CT Cares suite to be able to address employees and frontline workers, for example, family child care providers. So a lot of information there on our website. Federal loans, private loans, and grants all became very important. Again, no one knew what entering into a pandemic would mean to businesses, but we are definitely learning quite a bit here. And we want to thank our folks at Department of Economic and Community Development too, because they've been really instrumental in helping the entire state to look at business recovery and linking us with additional supports. All right, so our need on the next slide, we obviously need more federal support. As Commissioner Bye mentioned, we know that what we're doing is not enough to make programs whole, and that is a very, very hard thing for all of us across the entire agency. We're trying to find every opportunity to be able to help as much as we possibly can. We don't want to lose our good, healthy, safe programs, right? We have some great programs here that we're really trying to keep hold of. We know that we need more funds. We know that we're going to be working on this for a long time. So as I said, we'll continue to come back to you to ask you for additional information over time that can help us then seek out more support. For example, we have a partnership with FEMA right now, connecting us with other agencies and philanthropies to be able to try to find really innovative and creative ways to address some of our big bucket hot problems. All right, so let's move into the care package. So the care package is designed to be a lot of different things that programs can use when they are ready to be able to offset expenses. There's a lot within this. I'm going to walk through each of these pieces. I'll skip over expense and supply subsidy for the moment because we're going to get into some additional big detail on those in subsequent slides, but I just want to make sure we spend a little bit of time to talk about each of the other ones so that everybody has the information that they need. So I'll skip to the health and training subsidy. So as you may recall, early in COVID-19, OEC licensing announced that certifications that expired during the emergency declaration would be recognized as compliant. When the emergency declaration lifts, we know that we'll be working with some sort of a grace period and trying to get folks back into their certifications. What we're going to do is work with United Way of Connecticut, who's been a good partner with us around our Thrive platform. They've previously been organizing first aid, CPR, medication administration, and the emergency anaphylactic medication administration, or EpiPen training. And they've been doing that primarily for our family childcare homes through our family childcare union contract. We're going to be expanding that so that we can address the certifications that have expired during COVID-19, during the emergency declaration, or shortly thereafter. So obviously, we're still within the pandemic. We're not starting grounded training yet, so we don't have additional details of exactly when that will be, but we want you to know that that will be in place. We'll be using the OEC registry to be able to verify that you had first aid, CPR, med admin, or that your certification is expiring within the time frame that we'll be looking at. So you can make sure that your OEC registry account is up to date. The background check subsidy will add funds to continue a support that previously had ended. So we had good success with that, and we're recognizing that there's an opportunity there for us to be able to offset some more expenses for all of you. In the professional development arena, we have a lot that is happening. I think you've already seen that there is a webinar coming up that will showcase 4 different programs that have been open during the pandemic and highlighting some of their practices and lessons learned to be able to learn from them and gain some additional confidence. So we'll roll out additional webinars. Additionally, through your OEC registry account, you have access to online training. We're adding additional trainings there. So there will be new Connecticut specific trainings there in English and Spanish that will address running operations during COVID-19. And we're hoping to be able to add to that. We heard very clearly through the survey that you all wanted more communication, more training. The professional development was really important to you to make sure that not only you felt safe, other staff felt safe, but your families also felt safe. So you can go back and say to them, you know, here are the trainings that we have done. Here are the things that we're working on. Additionally, we wanted to make sure that we had scholarship available for credit and degree coursework. That's also available through your registry account. So you can take a little bit of time and check in on that. There's a slide later that will show you a couple key places in the registry that you'll want to look for that information. In addition, I just want to point out, we did recognize, we heard from a lot of folks that there were going to be disruptions. We talked to our colleges that we work with, and we knew that there were folks who had been awarded spring 2020 credit and could not finish the class. Some couldn't even start the class. And we have a policy that states that we won't pay twice for the same item. But in this case, we're waiving it, recognizing the hardship created by COVID-19. There are also additional information about policy waivers on the registry. So at the bottom of the registry is a Contact Us tab that you can use to contact your regional education advisor if you have any information about that. All right, business support. This is a big new thing for us, and this ties back specifically to the Louise Stoney quote. A lot of you talked about the fact that you just weren't sure what to do with applying for support. You weren't sure what forms you needed. You were scared about the forgivable loan part. You know, what if you ended up having to repay the loan and it wasn't forgiven? Some of you didn't have technology. A lot of concerns around not being confident in the business side of running a program of excellence. And so we are partnering with Women's Business Development Council to be able to offer extended services. Right now, any business can contact them for support. But what we're doing is staffing up a statewide support system. And there will be fiscal and technology incentives built in to be able to provide business coaching, to learn how to apply for things, to make sure you have the right documentation, to make sure you have technology. And WBDC will also be coordinating our statewide efforts around business supports. So we work with a variety of different partners. We have staffed family childcare networks. We have accreditation quality improvement supports. We have a lot of different things that are happening, and some have more significant than other pieces that address business support. We're going to make sure that that becomes as coordinated as possible so that we are getting out as much as possible to help you qualify for additional funds and to be in really good shape. We also want to make sure that at the end of this, you're filing your taxes the way they should be, right? There's a lot of different things that are moving business-wise, so we want to make sure that everybody is well protected. Program quality supports, again, for a program of excellence, we're making sure that our accreditation quality initiative supports, or our AQIS, is staffed up. We'll have an announcement coming soon about accreditation support coming out of that and free offerings for quality improvement work. You know, there are so many things that are different now, but there's so much that's the same. So best practices remain best practices. We may just be implementing them a little differently. AQIS will help with that. And the same for staffed family childcare networks. Great opportunities for family childcare providers to be able to be a part of a larger group and get membership benefits through those groups. They'll have business supports, coaching, have access to professional development and shared services. So really, really rich supports. Communication materials. Most of you hopefully have already seen the guide that was put out that has a lot of information and should be helping programs feel more confident about the layers of protection for health and safety. So everything from hand washing and wearing masks and so on. Things that we know how to do, but we're doing more diligently, and some new pieces of layering support as well. We'll be providing more shareable documents. We're hoping that you'll be able to use those in staff training and in family communication, helping to bring back some confidence for all of us as we go through this pandemic. And then the overall suite of the CT Cares programs, we'll be looking at some things that may be continuing or expanding, so stay tuned for those. All right, so now let's jump into our two subsidy components. So we have two key subsidy pieces. These are one-time fees that are one-time subsidies that we will be paying out. The expense kickstart is $8 million overall. It's CARES Act funding. We will have applications open July through mid-September. And I'm going to go a little more slowly through this so that I know this is something that you're all really interested in. We've talked about being able to provide funding. This is for licensed programs only. So for family homes, group homes, child care centers only. The program had to be operating in January 2020. That was the last kind of typical month that we had. And the program has to be open or verified reopening, right? So these are kickstarting that piece of where you are now and making sure that we have more supply available for families as more families are going back to work. The caveat in this is there are a couple things. The revenue piece is really important to note here. The program has to have received less than 50% of its January revenue from public funding. So Care for Kids, School Readiness, Child Care Contract, state or federal Head Start, right? We've put a lot of effort into really protecting that investment. As I said in a previous slide, you could see that in the initial phase of support, we made sure that the OEC protected those investments, and we're continuing to wrap out additional support for summer funding in a different way for these state-funded programs. So we're really wanting to make sure that we address those programs that have very few state-funded slots or certificates, and making sure that the programs that have none are also recognized. We heard that very clearly in the business survey. We'll be adjusting for part day, part year, or any combination thereof. There will be a 50% opportunity there in the expense kickstart. And really importantly, our state has invested a lot into the high quality practices of NAFCC accreditation and NAEYC accreditation. So we'll be recognizing programs that have either of those with a 20% increase. We're also looking at evidence of accreditation in process as of January 2020 for a 5% increase. We'll have more detail about what exactly that will look like because we have to have formal documentation from either NAFCC or NAUIC for those pieces. But really important for us to note that we are hyper-focused on those high-quality programs and the investments that we've made into them. Additionally, programs can't have enforcement action against the license. All right, so we'll make sure we spell all of this out in the additional detail that will come to you. Let's take a look at the amounts on the next slide. So this is the part where you sit there and you scan and you figure out, where am I? Which line am I? The program size is based on license capacity. All right, so our DCFHs, our licensed family homes, you will all be in extra small, okay? And then the other programs, it is based on license capacity. So you'll find your license capacity, scan across, the amount of the base expense kickstart is in that next column. And then if you are an accredited program, NAUIC or NAFCC, you'll receive that 20% increase, and your total amount is the far right column. The size levels align with the NAUIC size levels, although we did collapse large and extra large together into one. So you'll see it's not enough to make a program whole, but it is enough for you to have that, as we said, a kickstart, something that helps you to gain some momentum coming back into the market. And I know when we move off this slide, some of you will be saying, wait a minute, you're taking a picture with your phone, you're doing whatever you need to do. We will make sure that we are posting the webinar for you, so you can come back to this. And then there will be additional announcements and posting, so that you'll see this live on our website too. All right, now let's talk a little bit about supplies. So loud and clear in the business survey, you all talked about access to supplies, extra cost of supplies, preferences for supplies, and different arrangements you have for supplies. So some of you have janitorial services, some of you do the cleaning and sanitizing in-house. Obviously, there's cleaning and sanitizing throughout the day as well. Some folks said to us, you know, I'm totally fine. I can find the cleaners that I want when I want them. Others said, I'll take whatever I can possibly get. As you know, OEC has been providing PPE and originally some cleaning supplies through our distribution centers for programs that are open. This extends the opportunity for programs that are open or opening to offset expenses around the supplies. And when we talk about supplies in here, we're actually talking about not just your cleaning supplies, but PPE and other nursing and medical consultation. All right, so things that are COVID-19 related to help you around that health and safety side of programming and expenses. Again, the applications will be open July through mid-September. That's our plan. In this application, we're actually adding in licensed youth camps that are open. So we've been working very closely with our OEC licensing camp staff to identify those programs. The program, unless you're a camp, again, has to have been open with children January of 2020. There are no revenue restrictions on this. So regardless of the program receiving Care for Kids, School Readiness, Child Daycare Contract, state or federal Head Start, there are no revenue restrictions. We know that everybody has an increased cost here. And we want to call out specifically, you know, we know how to wash hands, right? It's early childhood. We spend a lot of time washing hands. This is part of our everyday practice to make sure that we stay healthy, pandemic or no pandemic. But we're doing so much more now. So we wanted to make sure that we recognize not only that increase, but also that, you know, you may want to reach out to your nurse consultant or to another medical professional in order to get additional support there. All right, let's go and look at the amounts. And again, you're all going to do that scramble to see where you are, how much the supply subsidy is. Again, you will see that 20% increase for NAFCC or NAEYC accreditation. Okay, there's a nice piece there, so your total amount is on the far right side. For the licensed camps, we have worked with the licensing staff to identify your size. So they have already designated the camps that are open as small, mid-size, or large. So I know the piece about license capacity does not apply there, but we have worked with the staff to be able to identify that. And I see, so there's a question asking again about enrollment versus license capacity. And this is your license capacity, okay? It's not the enrollment. We are saying you had to be open in January, but we're not using January enrollment. We are using capacity for this. All right, let's move to the next slide. So how do you apply? All right, so this is important because we want to make sure that the money gets out to the programs in a timely manner. And as you know, we have been working really, really quickly in the pandemic, like every other state agency, to be able to stand up different supports. As Commissioner Bye indicated, the CT Care suite already has been built out, and we've learned a lot of lessons around what worked, what didn't work, what was confusing. And so our IT staff has been working, to say crazily, it's just a lot of work. They've been working diligently to try to address all those things. So you'll first register as a vendor with CT Cares, all right? And we'll release a document with instructions for this mid-week next week, so Wednesday-ish of next week. It will have screenshots. We're also going to stand up a little video tutorial that'll walk you through things. So the first thing everybody will have to do is register as a vendor in the CT Cares system. We'll get you that information. It'll also include FAQs. But I think having those screenshots and the steps and a video tutorial will also be super helpful. If you're like me, I'm very visual. I'd like to be able to know, is this the right screen I'm on? What exactly are they asking us for? When you finish that registration process, the system will also remind you of things that you will need to then be able to apply for the expense kickstart and or the supply subsidy. We'll make sure that that is posted for you as well, trying to make sure everything is as clear as possible. We're also going to give you some information about who to call for some in-person technical assistance. The actual application for the expense kickstart and the supply subsidy will open the week of July 6th. So it's important for us to make sure that we have these two different pieces in order. If you were registered already for CT Cares, you're already receiving checks through the CT Cares suite, we will be transitioning that, moving that information over into the expense kickstart and supply subsidy portion too. So you don't have to re-register. We want to make sure everyone's really clear on that. We got you through it once. We're happy you're there. We don't want you to go through it again. We're going to move that information over ourselves. All right, and then the application will open the week of July 6th. Again, we'll tell you what you need to have on hand. We're going to preload a lot of information so that you will not be filling in very much at all. We'll preload your license information, so it'll have everything that's on file for your license, your capacity, your address, all that information. Your NAFCC and NAEYC accreditation status will already be entered in. Those are current, and we'll provide information on what to do for your evidence of being in process with accreditation. All right, so we know that there are a lot of questions. I know my colleagues are going to hop in to ask us about some different things that we might be able to answer. But we want to make sure that we thank you, because we've said before many, many times that we could not get to this point without you. You gave us so much information in the business survey. We're incredibly thankful for that. And I see Commissioner Bye's popped back on.
I'm back.
Back.
Margaret, I can't thank you enough. I think your presentation was really clear and thoughtful, and we know there are questions. I think we are excited to be able to share this with you. As I said at the beginning, it's not sufficient, we know that, but $10.5 million out to private programs will be helpful. We know it will be helpful, just like the $5 million in the Connecticut Cares for Childcare was helpful. And then having supports to support fingerprints, first aid, professional development. We've just put contracts out for accreditation support. We will be providing business supports. We know this is a long haul. We're in this for the long haul with you, and we need to continue to get your feedback. So I'll make sure to now, Rachel will facilitate questions, and Margaret and I, and there's some others on the call, will do our best to answer them.
Great, thank you, Commissioner Bye. So we've answered some of the questions, but there's still some questions about who can apply. So one question, a couple of different questions along the same theme. What happens if you've already applied for an SBA loan? Are you still eligible for the Kickstart Supply Subsidy program?
Okay. That is one thing some other states are looking at, is if you got PPP or SBA loans, then that's deducted here. No, in Connecticut, we're just saying this is available to everyone. The only caveat is we've been able to support state-funded programs in a lot of ways. And so we wanted to reserve this bucket of funding, which is a percentage of the CARES dollars, for private programs that don't get the benefit and haven't had the benefit of being paid for Care for Kids from March through June, and the other ways that we were able to continue to support programs. So Margaret said, look at your January revenues. If less than 50% of your revenues in January were from state funds, you can apply for this program.
When we're determining program size, how are we going to be handling programs with multiple sites? We received this question a few times.
That's a great question. So this is by license, all right? So it's specific to the license itself.
Great.
So if you have multiple places, you have multiple licenses, and each can apply for a KIC grant. Correct, Margaret?
Yes.
So there are some questions around sort of what documents will be needed to apply for the program. Margaret's already described that we'll be putting out instructions and documentation next week for folks when they are getting ready to apply. We have several questions around whether or not this is tax-free or taxable.
This is income, so this would be taxable.
Okay.
And we do want to point out also, Rachel, that that's such a great question. We do want folks to take advantage of our Women's Business Development Council partnership. So we'll be giving more information about that in the weeks to come, as it has actually just started up. But we want folks to be able to contact WBDC for support there too. We know that there will be questions when it comes time to file taxes. There's so many different things that people have potentially applied for and gotten, and how do you represent that in taxes? So we will be able to provide support there as well.
Great. So we're wondering about the timing of the CT CARES program and whether it will continue past July 3rd.
The Connecticut Cares for Frontline Workers program actually closed down this week. It was slated to close to end May 31st. We extended it for a month. The Connecticut Cares for Childcare is slated to end at the end of this month, and we're having some conversations. We have to make sure we have the funds. You know, now that we've put out these funds and we've put out the CT CARES program, we only had, it's a lot of money, but we only had so much money from the feds. And so we have to look at that and work with OPM. Of course, we'd like to continue that program, but we know that there are limited funds, and that's why we're really working nationally to try to get additional funds for early childhood education from Congress. And also, I think the other thing to keep in mind is that registering as a vendor here allows us to have a way to get funds to childcare programs. So we're really working hard and hoping for some federal supports for private and public childcare programs. And we believe setting up this whole structure of business supports will help us roll that out as well more easily and in ways that will support programs.
So we have a few questions about the timing of these payments, as well as the availability of payments, whether this is a first come, first serve payment, how will the cadence of payments, is it one time per week, per month? So if you can speak to those questions.
Yeah, I'm happy to speak to those questions. This is a one-time payment. Unfortunately, this is based on what we have. It's not first come, first serve. We have done the research, and actually your questionnaires, again, really helped us understand the total landscape. So we have budgeted for every private program in the state to be able to apply half day, full day. So it's not a race. What we foresee happening is that the application period will open for 2 weeks, then we'll process those, and then as we close for a week and then reopen for 2 weeks from July through September. So that's how we picture it going. Margaret, did you want to add anything?
I did just want to add one part because I neglected to do it when I was giving the slides. But when Commissioner Bye had to take this to OPM to get this approved, we relied really heavily on the business survey data that you all provided. So we know that we asked some very sensitive questions about revenue and expenses. We're very, very thankful for those of you who were able to provide us that information, because we used that data to be able to show OPM where the expense and revenue ratios were. So I just wanted to make sure I called that out. We'll say it again and again. You'll hear me probably for the rest of my life saying how thankful we are for all of you who took part in the survey.
So we have several questions. It was good that we reiterated, if you've already applied to be a CT Cares provider under other programs, you are already part of our system. But we have received some questions about payments and delays in payments from that program. So if we could speak to those.
Yes, I'm happy to speak to that. And that is why we have been so planful in rolling this out. As I've said, we stood that program up in 3 weeks, what would have taken a year, and our IT staff have been working around the clock. But part of the challenge was the program, we rolled it out, not in the program, and then had to upload information, and that just presented challenges. I don't need to bore you with the details. But we are working as quickly as we can. We've now assigned 10 additional staff at the office to help people problem solve. And so we are doing our very best. We know there's about 10% of providers who have had challenges with that system. And that's why we are rolling this one out with a lot of technical support. United Way is going to help us support this program like they did with the Frontline Worker program. So we're bringing in outside help. We have our help. Internally, we've assigned staff, and those payments should be coming. If you have specific, and the other thing is we found that people did not like just having an email, that when they're working on something, they want someone to talk to. So we're working on having live support and chat support. And as Margaret said, sending out pictures and a video to make it easier. So I have to apologize about some of those delays, and rolling out that program has informed this program, and we're going to do our best to get through those as quickly as possible. I know I'm emailing with 10 to 20 providers a week, working on resolving some of those challenges. So thank you for your patience. At our office, we say every day how important it is to get the funds out to the field, because programs are operating day to day right now with all the challenges they're having with enrollment and class size, and even considerations about reopening. So we're doing our very best to get that funding out to you as quickly as possible.
Great, thank you. We get this question in most of our conversations with providers around the group sizes, and when group sizes will be lifted, changed, and if changes in group sizes will apply to family childcare homes as well.
Thank you for that question. Right now, I don't know if Deb is on the phone. As I understand it, we didn't change the group sizes for family childcare. They stayed with our usual regulated numbers. Is there anyone on the line who wants to correct me on that?
That's correct, Beth.
Okay, that is correct. So those are where they are. Now on the center, I hope that some of you noted this week that Governor Lamont granted the Office of Early Childhood the authority to change program size and class size in collaboration with the Department of Public Health. And so any changes we propose to increase class size will go to a committee that includes, I think, two really important people. Like, we understand the business challenge, and we also have to take into account worker safety and child and family safety. And so on that committee is an epidemiologist, and then there's a workplace safety expert. And that committee meets today. We will be meeting with them today to look at that. But we are doing our very best to account for public health and to support early childhood educators and support the business needs of programs. And we understand the challenges you're up against, and we will keep you posted on that process and if there are changes.
Thank you, Commissioner. So we have received some questions about whether our webinar would be recorded. I have just posted a link to our OEC YouTube channel where we're posting this. We will post this webinar, and where we have posted past webinars. All of our webinars are recorded. If you register, you should receive a recording link or have access to the recording after, even if you can't attend or have to depart in the middle. So just know that if you weren't able to connect for the whole time here, or a colleague wasn't, that recording will be available to you. We did receive some questions, and I dropped a link to our comprehensive guidance for childcare centers during COVID-19. We are working on comprehensive guidance for family childcare centers, family childcare programs, and it is almost ready, so it has not yet been shared, but that would be in the same place on our ctoec.org website, where we would post information for providers. So that's coming soon. Last question.
Rachel, can I add one other thing? I just had from my office that we submitted this week 1,900 additional payments to the Office of the State Comptroller for the Connecticut Cares for Child Care. So that looks like when those payment comes out, that will clear a lot of the folks who've been facing challenges. So I just wanted to let folks know that.
Thank you. So our last question is around supplies. I know we've just discussed our supply subsidy. People just still have worries. It's not easy to find supplies. And we did have a question from a family provider who said they're just impossible to pick up during business hours and offering the suggestion of extended hours. So I'm wondering if you could just speak to the availability of supplies and things they can do to partner with the agency on that issue.
Sure. I'm gonna ask Deb Fliss to address this. And Deb, if you'd also talk about the family networks. I know all our KIN and other networks have been doing work to help providers with supplies, but I think if you could talk about both the supply work you're doing and then how maybe the networks can support some of these family child care programs that are having such challenges with supplies.
Sure. So Margaret did a really good job of providing the overview of supplies. I'll just add a couple of points. Most of the supply locations have advertised hours that are later post close of business. If providers are struggling with that, they should still communicate with those individual distribution locations, though, because accommodations can be made. The other thing that it's important to realize about what's happening in the supply locations is that for the reasons that Margaret identified around individual providers having their preferences for types of supplies, we are really moving from having a variety of soap and hand sanitizer and other products to having masks and gloves at these locations. But know that there are still some supplies of soap and hand sanitizer, bleach, and thermometers at most of the locations. We, in fact, received a gift of hand soap this past week in 16-ounce containers, 16-ounce containers that are quite easy to use in the childcare setting. And so those are available and being given out multiple to each provider. But please work with each of the individual locations around arranging a pickup, and know that you could also have someone else pick up for you if that's necessary and helpful. There are other resources for supplies, including CBIA, and we publicize those links. And I'm sure while I talk about it, Rachel will put it in the chat. And if not, we'll make sure that it gets out to everyone again. CBIA has made thermometers and masks available at the local level. And then importantly, the Department of Administrative Services has a vetted list of suppliers who have committed to having supplies available and in many cases have committed to holding prices firmly so that providers are not paying exorbitant costs. So those are worth exploring. And then finally, the point about family childcare networks. We are expanding our family childcare network effort to be sure that we have networks available throughout the state. One of the functions that some of those networks may be able to perform is group purchasing. We are also about to announce and make available the Early Childhood Shared Resources website. We will be calling it Connecticut Shares, and that website also will provide access for providers to supplies.
Thanks, Deb. Margaret, you had one other thing you wanted to share?
Yes, thank you. I just wanted to add, I saw a question about the first aid, CPR, MedAdmin, and EPI training. So Connecticut OAC licensing has not changed the requirement that this has to be grounded training. So we have been seeing some folks who've been trying to do some online things. So I just wanted to give a caution there. When the training becomes safe again, we will be coordinating that through Thrive. So regardless of how you do it, if you want to go through our subsidy portion or you do it on your own, just please make sure that you're aware that it still has to be grounded training. Thanks, Commissioner.
Right, and I appreciate that question as well in the chat, and we can discuss that with our licensing division. So thanks for joining us today. We're going to host another one Monday, so if you have colleagues that weren't able to make it, we just let them know, and in Monday it will be in English and Spanish. We apologize, this was not in both. We're trying to do all of our rollouts that way, which is a part of why we're doing this again, and look for information next week. Most importantly, thank you for your service to children and families, and stay safe.